Hi everyone, so I am here with you today ending our session on assessment. We've been talking about the Brain Warriors Way, and with that making sure that we cover, we're going through mastery. So mindset, and now we're on assessment. Assessment was pretty long. Next is going to be sustenance, which is the food of a warrior. That one's going to be even longer than assessment because that's where really just so important that you understand how food's affecting your body. So interesting, a new study just came out. Fascinating. It's the first actual study that was a definite link between how you eat and your mood, depression. Specifically, it was could you improve depression with food? And the answer to the study was yes. So really interesting. So we want to spend some time on that. As we end assessment today, I want to go through everything we've been talking about, but I want to, before we end it, ask you how many of the modifiable risk factors for Alzheimer's disease and dementia are you engaging in? So I want to be clear, that was modifiable. That means that you have some control to change it, right? So you have a lot more control than you think and more than we used to think you had, because now the studies are coming out about what causes or what leads to Alzheimer's disease. Yes, there's a piece of it that's genetic, no question, but really there's so many factors that increase your risk of depression, of Alzheimer's, depression being one of them, that you need to be checking this out because you have a lot of control to change this. Just because you have the genes and the gun is loaded doesn't mean you always have to pull the trigger. So let's take a look. First of all, with assessment, why assess? Why do you need to assess? So we've been talking about that. And I love this term in martial arts that we use called SARA, scan, assess, react, assess. And then you have to do that repeatedly. So if you are feeling threatened in a situation, you scan the environment, you assess what's going on, you figure out what you have to do, you react accordingly, and then you reassess. And you have to kind of keep doing that all the way through. So it doesn't just stop, right? So I want you to just think about that as we go through. Scan, assess, react, assess, because you're going to have to do this over and over. So why is it important to assess your brain? Because you want to prevent Alzheimer's, right? Because you want to prevent just so many of the diseases of lifestyle that really contribute to a lot of brain problems. And how do you prevent Alzheimer's? According to my husband and a lot of the experts in this field, Dr. Bredesen, who we've done studies with from UCLA, you prevent all the things that cause Alzheimer's. So that's really where it starts. So we want to prevent those risk factors that cause Alzheimer's because a lot of them you have control over. So in a 2015 study, really interesting, there were 9 modifiable risk factors that they looked at that you could literally change in 2/3 of the cases of Alzheimer's presented. So that's a lot. There's 9 modifiable risk factors responsible for 2/3 of the cases of Alzheimer's that contribute to it that you can change. So let's take a look. What are they? Obesity. So obesity, as your weight goes up past what's a healthy normal weight, the size and function of your brain goes down. And there's a lot of reasons for that. It's the inflammatory cytokines. So these chemicals that are in your body, fat cells are not innocuous. It's the blood sugar. It's the choices that you're making. So the choices you're making, you're eating things that are probably really not helping you. So obesity was one of them. Believe it or not, lack of education or lack of attaining education. So not continuing on with your education. So that's something you can change. You can enroll in classes. I mean, now the internet makes everything, at our fingertips, and you can do this stuff for free. So daily education, doing something that challenges you, that makes you learn, that makes you grow. That's one of the ways that you can actually help your brain. Depression. So depression actually doubles your risk for Alzheimer's disease. So get that treated. And that's why we're going to be spending so much time on sustenance, because your food, your nutrition really makes a big difference in your brain function. What you're eating that's not good for you is really contributing, and what you can eat to change it, you'll be surprised at how much you can do just with your nutrition and even exercise. Exercise, of course, was one of the other ones. Lack of movement is one that you have control over. Start moving. Like today, I did 2 radio interviews. I was pacing around the house and walking up and down my stairs while I do that. So just move. Find ways you can move. Homocysteine. So homocysteine is one of those numbers. So a high level of homocysteine was one indicator, and that's something that you can modify through your diet and your exercise and your lifestyle. And we talked about that along with your important numbers. When you talk about getting your important numbers checked, that was one of the numbers that we talked about. So if you don't remember that, go back and watch the video from a couple weeks ago on your important numbers and homocysteine. And then type 2 diabetes, for the same reasons we just talked about. Type 2 diabetes because it affects your weight, because it affects your blood sugar. Blood sugar affects your brain, makes your brain, your vessels in your brain more brittle. So that's one of the reasons that type 2 diabetes is one of those risk factors. And type 2 diabetes is actually modifiable. You can actually, reverse diabetes, type 2, not type 1, with how you live. My phone is blowing up in case you wonder why I keep reaching over here. Someone keeps sending me messages. So metabolic syndrome, again, that goes along with diabetes and your weight and your heart. So metabolic syndrome, interesting. A Russian study showed that metabolic syndrome decreased blood flow to every area of the brain. So that's why this is why we keep harping on this. And, we're not going to stop because this is important. You can control that through all the things we're talking about now. So what is that? That's really your heart function, like your vessel function, your blood pressure, your blood sugar, diabetes, and your weight. So we want to look at those risk factors. So someone said love exercising. Excellent. Then there's hormones. So it's really sort of a weird thing, but a lot of scientists now think that one of the reasons we go through these massive hormone shifts at a certain age is it's sort of the planet's way of making room for the next generation, right? Well, I'm not really okay with that because I really enjoy hanging out with my family. I'm not ready to leave them just because the planet says so. So, but that's one of the reasons they think that our bodies shift so much. It's like we're done making babies. Now it's time to make room for the people who are making babies. So, but you can actually change that. Get your hormones checked. There are a lot of natural things you can do to help that because, believe it or not, having low testosterone, low progesterone, low estrogen, low thyroid, all of those things increase your risk of problems with your brain, your memory, focus, mood, all of that. Sleep apnea was another one. So sleep apnea is when you snore really loudly at night and you stop breathing for periods. So if someone's ever told you, gosh, you snore like a freight train and then you stop breathing, that's a really bad thing and you should get it treated because that you're literally suffocating your brain cells. So when we look at the scans of people with sleep apnea, they're just terrible. And so we want you, but you can fix it, right? So do that. Insomnia. So really interesting, since we're talking about warriors, I love this study. Soldiers who slept 7 hours a night, they did a study in the military, and soldiers who slept 7 hours a night were 98% accurate on the range the next day. If they slept 6 hours, one less hour per night, they were 50% accurate on the range the next day. We're talking about handling guns, right? So this is important. If they slept 5 hours, they were 28% accurate. And if they slept 4 hours, they were dangerous. They were only 15% accurate. So why is it that sleep affects our brain so much, our memory, how we focus? Also, why does it put us at risk for Alzheimer's? Because there's this process of autophagy. It's where your brain literally sends in, like, this is how I visualize it, like a little crew to clean up all the debris in your brain. But you need to be asleep because your brain's too busy during the day. So it does that when you're asleep, and you need to sleep at least 7 hours. So that's what the studies showed. Not managing your stress. So we all have stress. We're not getting away with not having stress, right? We all go through life cycles of issues with children, when they leave home, or if we're having problems with them, people in our family who are sick, or deaths in the family, or moving, loss of a job. All those things happen to all of us at some stage. I know I certainly got blasted by a whole bunch of that in my early 20s. I was sick always as a kid, never really didn't feel some of that stress. But in my 20s, with going through my situation with my health, having cancer 3 times, filing for bankruptcy, dropping out of college, all of these things. It was such a young age to experience that. But there was nobody really to help me out through that financially, right? So you just experience what you go through. And those stressors really do damage to your brain long term if you don't find a way to manage them. So out of necessity, I started doing a lot of this research. So prayer, meditation, hypnosis. Studies have shown that medical hypnosis actually calms down your emotional brain and stimulates your frontal lobes. Meditation and prayer stimulate your frontal lobes. So that's that thoughtful part of your brain. That's your executive part of your brain, so that it improves your impulsivity. You make better decisions, and you're more present. So not that you're going to get away without stress, but you need to have a way to manage it. So look at your stress management coping skills now and ask yourself if you really need to improve them. And then you've got to be disciplined. Taking that 5 to 10 minutes a day to sit down and pray and meditate, yeah, it's discipline, but it will make a radical difference in your life. Depression doubles your risk for Alzheimer's disease, and so does PTSD. So post-traumatic stress disorder, or syndrome, I'd rather call it a syndrome, but we see it all the time. And it's not just soldiers. They have found that children who grow up in really chaotic homes with a lot of trauma and drama in their lives have very similar brains to soldiers coming back from war. This is really important. Children who are abused suffer some of the same consequences. So think about that with your parenting, or if you grew up in that kind of home, make sure you do something for it. EMDR is a great type of therapy that I really love. Exercise. I always say it's medicine for my brain, but it's also one of the best ways to grow brain cells. It's one of the best ways to improve BDNF, or increase BDNF in your brain, which is like your brain's miracle grow. So brain-derived neurotrophic factor helps grow brain cells. And then gadget addiction. So Hewlett-Packard did a study, and they showed that people who are addicted to their gadgets and spent excessive amounts of time on their gadgets dropped 10 IQ points per year. That's crazy, right? When all you have to do is get outside and go for a walk instead. So really important. So the takeaways for the assessment phase here. Assess your brain. You can go to our website, amenclinics.com. You can take our free brain health assessment. You can check out your brain type. Fight this war on multiple fronts. So I like to think about this like, the military. It's land, air, and sea, right? So they're fighting it from multiple fronts when there is a threat. You need to also, in this war for your brain and for your health, you got to fight it on multiple fronts. All the things we just talked about, you want to be addressing those. If you do have the genetic vulnerability, you need to be even more serious about all the things we just talked about. Nutrition, all of these things make such a radical difference. Your inflammation. So some of those numbers we talked about earlier, make sure that you're addressing inflammation and blood sugar. So, and then also detox. So we talked about a little bit about detox. We'll go more into that as we go. But be thinking about detoxing, getting some of the things out of your life that you know are toxic. Not just people, okay, because they can be very toxic, but some of the substances in your kitchen like Teflon, plastic, the lining inside cans, so BPA. So look for BPA-free cans, or more often than not, try to not use cans. But when you do, look for BPA-free. And assess these multiple risk factors repeatedly. Make sure that you're not slipping into them. And then always remember, scan, assess, react, assess. Sarah. So I hope this has been helpful, this session on assessment. It's gone on for a couple weeks now as we move into food. So going to be a lot of stuff in food. It's going to go on for a while. And send me your questions. So I'm sorry that my schedule has not been more predictable, but between my travel schedule and crazy construction going on in my house, it's been a little bit hard to stay consistent. Also homeschooling now. I'm enjoying homeschooling so much. In fact, one of the questions that was asked to me, I keep getting this a lot. It's not one of the questions. I've actually had a lot of you asking me questions about why I would choose to homeschool. So for us, it worked for our lifestyle and what we were trying to accomplish, but there were a lot of reasons that went into that. We're super happy we did it, that we're doing it. We're just loving it. My daughter loves it. We love it. Not only do we get to have her at home during this very vulnerable age, so she's 13, she's in 8th grade, she actually wanted to be homeschooled. She didn't like what she was seeing going on at school, felt no need for it in her life. So we did that. We decided to homeschool her. She came home one day and said, I feel like my potential is not being met. I'm capable of more. And in classrooms where teachers have 6 classes a day, or actually 8 now, it's 8 classes they have with 36 to 38 children in each class. She's like, I don't get the attention I need, and I feel like they're teaching to the average, and I don't really want to be average. So interesting that she would notice that. And she felt like she was capable of doing a lot better, which, by the way, she is. She's like got straight A's now. It's amazing, even in a couple of subjects that were hard for her. But also that this very vulnerable age, we want her to be with us as much as possible. She can travel with us. And it's just working out to be amazing. I get to spend so much really cool bonding time with her, and we're just doing these really cool things. So yes, it takes a lot of time on my part. I apologize for not being more consistent with my schedule with you, but like I've told you when we started all of this out, make sure you know your values. And my values are very clear to me. It's God, health, family. You would think that family would be higher than that, but it's not. Because it's got to be God, it's got to be my health. Because if I'm not healthy, like I wasn't in the past, I can't be there to really help my family. So I'm constantly doing this assessment right along with you. There's always things that all of us can improve. So there's never failing, only falling. Just remember that. Just as long as you get back up, you never failed. Doesn't matter how many times you have to start over. So I hope this is helpful, and I will try to get back to you this weekend if my house is not completely torn up, and we'll start on food. All right, have a great weekend. Bye-bye.